Hello everyone. Our topic for today is the bones of upper limb. First, let us look at the parts of the upper limb. We have four parts in the upper limb. They are shoulder and the forearm, arm and the hand. This is the shoulder, this is the forearm, this is the arm and this is the hand. These are all about the parts. Now let us look at the bones. We have 33 bones in total. Now let us see them. We have clavicle. This is the clavicle here. And we have scapula. And this is the scapula. And we have humerus. This is the humerus here. We have ulna. This is the ulna. And we have radius. And this is the radius. And we have 8 carpal bones. These are the carpal bones here. And we have 5 metacarpals. These are the metacarpals. And we have 14 phalanges. And that's all about it. Now let us look at the scapula. And we have two surfaces. They are posterior surface and anterior surface. This here in the diagram is the posterior surface. And now let us look at the anterior surface. This is the anterior surface. This is the anterior view of the scapula and this is the posterior view of the scapula. And we have three processes. They are acromion process, spine of scapula and coracoid process. Now let us see them in the diagram. This here is the acromion process, this is the spine of scapula and this is the coracoid process here. Now let us look at in the anterior view. This is the coracoid process here, this is the acromion process and we can't find the spine of scapula in the anterior view. Posteriorly, the spine of the scapula divides the scapula into the two parts. This spine of scapula divides the scapula into the two parts posteriorly. That is supraspinous fossa and infraspinous fossa. So this is the supraspinous fossa here and this is the infraspinous fossa. Supraspinous fossa is small and this is above the spine of the scapula. Infraspinous fossa is large and this is below the spine. This is the supraspinous fossa here and this is the infraspinous fossa. In the supraspinous fossa, supraspinatus muscle is attached. We have the supraspinatus muscle. And in the infraspinous fossa, we have infraspinatus muscle. In the anterior surface, we have subscapular fossa. This is the subscapular fossa here. And this subscapular fossa accommodates subscapularis muscle. And we have the subscapularis muscle here and the subscapular fossa. In the superior border of the scapula, we have the suprascapular notch. This is the suprascapular notch here. Laterally and superiorly, the spine of the scapula extends as the acromion process. This is the acromion process here. For the spine of the scapula, the two muscles are attached. They are trapezius and also the deltoid muscle. These two muscles are attached to the spine of the scapula. This acromion process attaches to the clavicle to form acromioclavicular joint. And we have the coracoid process here and this is the anterior view of the scapula. To the coracoid process and the acromion process, coracoacromion ligament is attached. In this way, the coracoacromion ligament is attached to the coracoid process here. This is the coracoid process here and this is the acromion process here. In this way, the coracoacromion ligament is attached. This coracoacromion ligament stabilizes the glenohumeral joint. This is the glenoid cavity here. This is the glenoid cavity. In this glenoid cavity, humerus head is attached to form glenohumeral joint. This glenoid cavity is attached to the humerus head to form the glenohumeral joint. Above this glenoid cavity, we have the supraglenoid tubercle. This is the supraglenoid tubercle. Below the glenoid cavity, we have the infraglenoid tubercle. This is the infraglenoid tubercle. This supraglenoid tubercle is attached to the long head of triceps brachial. The infraglenoid tubercle is attached to the long head of triceps brachial. This is the clavicle here and this is the acromion process here. This clavicle attaches to the acromion process to form the acromioclavicular joint. This is the acromioclavicular joint here. And this is the glenoid cavity here and this is the head of the humerus. This together forms the glenohumeral joint. This is the glenohumeral joint. And that's all about the scapula. Now let us look at the clavicle. This is the clavicle and this is the acromion end, also known as the lateral end. This is the sternal end here, or also the medial end. Acromial end attaches to the acromion process to form acromioclavicular joint. This acromion end of the clavicle attaches to the this medial end attaches to the mandibrum of the sternum to form the sternoclavicular joint. This is the sternal end which is attached to the mandibrum to form the sternoclavicular joint. Clavicle is the only bone that attaches in between the trunk and the upper limb. And this is S-shaped bone. This is the anterior surface and this is the posterior surface. Medial 2 by 3 of the clavicle is convex and lateral 1 by 3 is concave. Medial 2 by 3 is, this is the medial side and this is the lateral side. Medially it is convex and laterally it is concave. Clavicle keeps the limb away from the trunk, which allows the free movement of upper limb. And this clavicle also forms the boundary of the cervico-axillary canal, protecting the neurovascular structures. Clavicle has no marrow cavity inside. It is a spongy bone and the superior surface of the clavicle is smooth and the inferior surface is rough. This is the superior surface, this is smooth and this is the inferior surface, this is rough. This has the conoid tubercle here. This conoid tubercle is attached to the conoid ligament. This conoid tubercle serves as an attachment for the conoid ligament. And we also have the trapezoid line. This is the trapezoid line here, which serves an attachment for the trapezoid ligament. We also have the subclavian groove. This is the subclavian groove here, which serves an attachment for the subclavian muscle. And that's all about the clavicle. Now let us look at the humerus. Humerus is the single bone in the upper limb. And this is also the largest bone in the upper limb. And this humerus proximally attaches to the glenoid cavity of the scapula to form the glenohumeral joint. This forms the glenohumeral joint. This is distally attached to the radius and ulna to form the elbow joint. And this head has the greater tubercle. This is the greater tubercle here and it also has the lesser tubercle. This is the lesser tubercle here. The greater tubercle serves as an attachment for a few muscles. They are supraspinatus, infraspinatus and teres minor. All these three muscles are rotator cuff muscles. And we also have one more tubercle, that is lesser tubercle. This lesser tubercle serves as an attachment for subscapularis muscle. And to remember all this, now let us see a mnemonic, that is SITS. S-I-T-S. S for supraspinatus, I for infraspinatus, and T for teres minor, and S for subscapularis. This is the mnemonic which is helpful for remembering all these muscles. Between the greater and lesser tubercles, we have the intertubercular sulcus. This is the intertubercular sulcus. This intertubercular sulcus or groove serves an attachment for the tendon of biceps brachii muscle. This intertubercular sulcus is also known as the bicipital groove and it serves an attachment for the tendon of biceps brachii. And we also have the anatomical neck. This is the anatomical neck here and we also have the surgical neck. This is the surgical neck here and this is the anatomical neck. This anatomical neck is formed by the groove that is separating the head and the tubercles. This anatomical neck separates the head from the tubercle and this is the surgical neck here. This surgical neck is weaker and the common site for the fracture. And below this, we have the deltoid tuberosity. This is the deltoid tuberosity here, where the deltoid muscle attaches. And this is the shaft. Distally, we have two bony projections. They are medial epicondyles and lateral epicondyle. This is the medial epicondyle. Above this medial epicondyle, we have medial supraepicondylar ridge. So this is the medial supraepicondylar ridge. And laterally we have the lateral supraepicondylar ridge. This is the lateral supraepicondylar ridge. Lateral supraepicondylar ridge serves as an attachment for the four muscles. They are brachioradialis, extensor carpi, radialis longus, and also the triceps brachii. These are the four muscles attached to the lateral supraepicondylar ridge, and three muscles are attached to the medial supraepicondylar ridge. The three muscles are medial head of triceps brachii and the brachialis and the pronator teres. These are the three muscles attached to the medial supraepicondylar ridge. These condyles of the humerus attaches to the radia and the ulna through trochlea and the capitulum. And this is the trochlea here, and this is the capitulum. Trochlea is located medially and capitulum is located laterally. Trochlea is attached to the trochlear notch of ulna, and this capitulum is attached to the head of the radius. The humerus is attached to the radia and ulna to form the elbow joint. Above the trochlea, we have the coronoid fossa, and above the capitulum, we have the radial fossa. This is the radial fossa here, and this is the coronoid fossa here. This coronoid fossa attached to the coronoid process of ulna, and this radial fossa attaches to the head of the radius. This coronoid fossa attaches to the coronoid process of ulna, and the radial fossa attaches to the head of the radius during the full flexion of, and posteriorly we have olecranon fossa. This is the olecranon fossa. And we also have the trochlea here, which is attached to the trochlear notch of ulna. This olecranon fossa is attached to olecranon process of the ulna. This olecranon fossa is attached to the olecranon process of ulna during the extension. And that's all about the humerus. Now let us look at the ulna. And this is the ulna here. Ulna is the stabilizing bone of the forearm, and it has radius laterally. This ulna articulates with the trochlea superiorly and the radius laterally. And it has some few processes. Now let us look at them. This is the olecranon process. As we already discussed, this olecranon process sits into the olecranon fossa of humerus. This is the trochlear notch here. The olecranon and coronoid process together from the trochlear notch. This is the olecranon process here, and this is the coronoid process here. These both together form the trochlear notch. This is the trochlear notch here. Distal to this, we have the tuberosity of the ulna. This is the tuberosity of the ulna. The brachialis muscle inserts onto this tuberosity of ulna. Laterally, we have the radial notch. This is the radial notch here. To this radial notch, it is attached to the radius laterally. Radius and ulna together form the radio-ulnar joint. And we also have the supinator crust. This supinator crust attaches to the supinator muscle. This supinator muscle helps for supination. This is the shaft of the ulna. The interosseous membrane is attached to the shaft. This interosseous membrane connects both ulna and the radius. This interosseous membrane helps both the bones to move as one. And we also have the head of the ulna here. This is the head of the ulna. This head of the ulna does not participate in any radiocarpal joint. And we also have the ulnar styloid process. This is the ulnar styloid process. To this, we have ulnar collateral ligament attached. That's all about the ulna. Now let us look at the radius. This is the radius. This is parallel and lateral to the ulna. This is the head. It has the concave depression. It is also the disc shape, which is helpful for pronation and supination. Medially, it is attached to the ulna. And below the head, we have the radial tuberosity here. This is the radial tuberosity. This radial tuberosity is rough posteriorly and smooth anteriorly. This rough posterior surface serves as an attachment for the tendon of biceps brachii muscle. And this is the shaft, and distally we have the ulnar notch. This is the ulnar notch here. This ulnar notch joins with the ulnar head and forms the radio-ulnar joint. And posteriorly we have the dorsal tubercle here. This is the dorsal tubercle, and this dorsal tubercle is also known as the Leicester's tubercle. And distally it has two facets. They are facets for articulation with the scaphoid bone and the facet for articulation of the lunate bone. This is the facet for the articulation with the scaphoid, and this is the facet for articulation of the lunate. And this radius articulate with scaphoid and ulna to form radiocarpal joint. And laterally it has the styloid process. This is the styloid process here. This styloid process is larger than the ulnar styloid process. Now let us see how the humerus is attached to the radius and the ulna. This is the humerus, and this is ulna, and this is radius. The capitulum of humerus is attached to the radius head. This is the head of the radius, and this is the capitulum of the humerus. And this is the trochlea here. This trochlea is attached to the trochlear notch of the ulna. This is the trochlear notch. And that's all about this. Now let us look at the hand. In hand we have three types of bones. They are carpal bones and metacarpal bones and phalanges. These are phalanges here. These are the metacarpals here. And these are the carpal bones. Now first let us look at the carpal bones. We have 8 carpal bones. Now let us look at them from lateral to medial side. Lateral to medial side. This is the scaphoid bone. This is the lunate bone. This is the triquetrum bone. And this is the pisiform bone. We have scaphoid first, and then after the lunate, and then after the triquetrum, and then after the pisiform. Now let us look from the medial to lateral side. This is the hamate bone here, and this is the capitate bone here, and this is the trapezoid bone, and this is the trapezium. Now let us write them. First we have the hamate bone, and then we have the capitate, and we have trapezoid, and we have the trapezium. Hamate bone have a hook. The ulnar nerve passes through the hook of the hamate, and the scaphoid here and the lunate articulate with the radius. The scaphoid and the lunate articulate with the radius to form the radiocarpal joint. And there is a fibrous disc in between the lunate and the triquetrum, that is the fibrocartilaginous disc, which separates these lunate and triquetrum bones from the ulna. We have the pisiform bone here. This is the pisiform bone, which lies the anterior to the triquetrum bone. This pisiform bone cannot be seen on the posterior view. And that's all about the carpals. Now let us look at the metacarpals. We have 5 metacarpals. These are the 5 metacarpals. These metacarpals have 3 parts. They are head, shaft, and the base. This is the head of the metacarpal, this is the shaft of the metacarpal, and this is the base of the metacarpal. The distal carpal bones and the metacarpal bones join together to form carpometacarpal joint. Superiorly, these metacarpals attaches to the phalanges to form the metacarpophalangeal joint. These are the metacarpophalangeal joints here. These are the carpometacarpal joints. These metacarpophalangeal joints form the knuckles of the hand. This is the first metacarpal, this is the second metacarpal, this is the third metacarpal, this is the fourth, and this is the fifth metacarpal. This first metacarpal bone is separated from the remaining metacarpal bones to give the thumb the independent movement. And that's all about the metacarpals. Now let us look at the phalanges. And these are the phalanges here. We have the total 14 phalanges. These are the 14 phalanges. Each one have 3 phalanges except one, which has only the 2 phalanges. And each phalanges have the head, the shaft, and the base. And that's all about the bones of the upper limb. If you like the video, please do like, share and subscribe to my channel. And if you have any queries down and the suggestions for this channel, please do comment down in the comment section below.